Taiwan, being the largest of its kind over there, it had been in service for just over 2 years.
Japan is bracing for destructive winds and huge waves as Typhoon Vongfong churns towards the southern islands of Okinawa. Flights in the region have been cancelled and ground transportation is halted. The death toll from the powerful storm has risen to 9. Vongfong is expected to make landfall on Sunday with winds of more than 160 kilometers per hour. Officials are warning that high seas, storm surges and torrential rain will likely lead to flooding and mudslides.
The United Nations Special Envoy on Ebola says only 1/4 of the $1 billion appeal to fight the Ebola virus has been funded. He says the response to the outbreak has to be 20 times greater than it was at the beginning of the month, as the death toll has now risen above 4,000. Alan Buckner reports.
In Liberia, the hardest hit West African country, U.S. soldiers are working around the clock building a 25-bed hospital specifically for healthcare workers treating Ebola patients.
So this will give people, the healthcare workers, hope that if they go in and if they contract this deadly virus, they can be treated here.
But the number of facilities currently being built in the region is just a small fraction of what's needed. In the Netherlands, the first of 3 planes bound for the stricken West African countries was loaded with 100 tons of emergency equipment donated by the European Union, including medicine, face masks, and protective gear. But at the United Nations General Assembly, the Special Envoy on Ebola warned that the number of cases is probably doubling every 3 to 4 weeks.
This going to scale, perhaps increasing the level of response 20 times greater than it was at the beginning of this month. It involves just about every country in the world, because without that mass mobilization, without a global movement, it will be impossible to get this disease quickly under control, and the world will have to live with the Ebola virus forever.
In Dallas, the U.S. House Committee on Homeland Security started a hearing Friday to look into the case of an Ebola patient who died Wednesday. Thomas Eric Duncan went to a hospital emergency room on September 26th with a high fever. He was sent home with antibiotics despite telling the staff he had recently arrived from Liberia. He was only diagnosed with Ebola after returning to the ER 2 days later. In Madrid, the country's health minister announced Friday that all health staff in contact with Ebola patients will be actively monitored and considered high-risk contacts. This comes after a Spanish nurse who was part of a team that treated 2 priests with Ebola became the first person to contract the virus outside West Africa. Healthcare workers believed to be caring for Teresa Romero could be seen in the hospital she's in wearing protective clothing. Health officials say Romero is stable but in critical condition. Alan Buckner, TVB News.
The United Nations says thousands could be massacred if the Syrian border town of Kobani falls to Islamic State fighters. The warning comes as the Sunni militants close in on the besieged town. James Aitken reports.
3 weeks into the siege of Kobani, Turkish ground forces continue to look on from just a few hundred meters away. Turkey has said it won't allow the town to fall to Islamic State fighters, but so far there's no indication its military is about to intervene to save the town. Kurdish forces say the U.S.-led airstrikes alone are not enough to halt the militants' advance. Speaking to a reporter by phone, a Kurdish defense chief said Kobani is now surrounded on 3 sides by Islamic State militants. He's called for outside help to create a corridor to evacuate the remaining civilians. The United Nations is warning of mass casualties if the militants overrun the town.
When 1/3 of Kobani city has been overtaken by ISIL, this is a source of really great concern. That is why from the beginning of this crisis, I have been urging the leaders of the several countries, whoever may have capacity and means to do all what they can.
Turkey has agreed to support efforts to train and equip moderate Syrian opposition forces, but the U.S. doesn't yet know if Turkey is willing to do the training inside its own borders. A U.S. Defense Department planning team is heading to Turkey next week to discuss the details.
Part of those discussions will include how far Turkey is willing to go with commitments. Certainly one of those questions will be, would they be willing to provide training locations? As you know, Saudi Arabia has already committed, and we have other countries that have offered sites as well.
Turkey and other U.S. allies want the U.S. to create a no-fly zone inside Syrian territory. But the U.S. is resisting creating a protected corridor, which would require hundreds of aircraft and cost as much as $1 billion a month to maintain. James Aiken, TVB News.
All right, Tony, over to you for sports.
That's right, we've got some baseball to talk about and some football. In the Major League playoffs, the Kansas City Royals broke a tie at the top of the 10th inning to beat the Baltimore Orioles in Game 1 of their American League Championship Series, with the game hanging